how are you? I'm Simar again for the NCLEX RN videos and for you to help to pass the exam, and also I'm here for teaching the other topics. So today my topic will be in pediatrics. So this is very important topic for the this disease occurs in the children. So disease name is Hirschsprung disease. So this disease is like congenital disease condition is during the birth of the we can say during birth of the infant. This disease is we can see the symptoms. So this disease is occur in like infants, newborn infants. So in that who have the Down syndrome or other congenital abnormalities. So this disease happen to that infants. So in this, what we can see the sign symptoms. So because this disease, has spring disease, is like there is no ganglion. Like another name of this disease is a ganglion or megaclone. So it's clear from the name this disease is no ganglion, means no nerve cells. So in the large intestine there is no moving of the bowels, no movings of the they can't be past the bowel movements. The infants is very hard to pass the bowel movement. In the 48 hour they must have to pass the meconium, but in this disease they couldn't able to pass the meconium. So that's why it's bile like vomit also happen, because of bile also accumulate, and the infant is showing the abdominal distension, and they also other symptom, like we can say they have the obstruction. We can see also like refusal to suck, bile stain, vomiting, and failure to pass the meconium. So in the elder, like if the in the children, we can say with the advanced age, it can be like they can't be grow up, they can't be like their growth is retarded, and also they have like constipation with diarrhea. So what is the we can say assessment? In the assessment we can see like the child when they have aged, then they can't be their growth is retarded, they have constipation, and again they have like sometime in between diarrhea. So these are the assessment we can see. In the diagnosis, so mainly diagnosis we can go for the biopsy. With the biopsy we can see the tissues, like there is no like a ganglia is present, so that helping in the movement of the bowel. So there is a also complication. If the disease is not treated, then can cause the enterocolitis, like intestinal small intestinal infection could be happen. So it could also affected the other parts of the body. So also there is a GI bleeding happen. Like a GI bleeding means like other, when there is like a mega clone, and the other parts of the colon also affected, like that causing the obstruction to other parts, and that's causing the GI bleeding also. Infection could happen. So in the medical and surgical management, if there is like a need to be go for like treatment, they sometimes they going for temporary colostomy. In this they until the treatment is like in the permanent treatment, they going for the colostomy for the bowels to pass. But in that case, medical management, if the child or infant is not going for the temporary treatment, then they going for the we can say medical treatment, like they go for regular enema or regular fiber diet, stool softener they can give, and also normal saline irrigation that help in passing of the bowel movements. So in surgical management, what they doing in surgical management, excision of the part of the part of the intestine, there like that part where there is no ganglion, there is no nerve cell, that part should be take out from the intestine. So in that, so other part of the intestine directly connected to the anus. So in that case, like this is surgical procedure, and they just cut out the part where there is no ganglion. So in the surgical, we can say in the surgery pre-operative, what we can do, we can maintain the NPO status of the patient, and also we need to be check if their breathing is good, because of bowel obstruction, maybe breathing problem can happen. We need to check intake, output. We need to check abdominal girth. We need to make sure like a patient has like a proper fluid and electrolyte balance. Patient don't have dehydration. We need to check for infection. If the patient have infection, we need to be go for antibiotic as prescribed by the doctor, because we can't go for surgery if the patient has infection. It can lead to the more complications. And also like in this we need to be check the like patient infection and bowel function also, we need to be check for that. So in this, firstly, next is post-operative after the surgery. What we can go for in the post-operative, whenever patient come after the surgery, we need to check the vital signs, patient ABC, airway, breathing, circulation. We need to check the site for bleeding, any redness, any swelling. We need to check the abdominal girth. We need to be checked like intake output and make sure like patient weight is okay, intake output is okay. We need to be make sure like patient is not dehydrated intake and output, and make sure patient like patient is, if patient is dehydrated, we need to go for the IV infusion fluid for the fluid and electrolyte. And also if the patient needs suctioning like for the oral suction, we need to go for and maintain the patient NPO status until the bowel sound is returned. This is very important question, like patient should be maintained NPO until the bowel sound is returned. So in this also, like they need to be make sure like they teach the, if the patient has a stoma, like and doctor after the surgery doctor make a stoma for temporary, so make sure teach the patient and the family like how to care for the stoma. What's the normal color of stoma is like pink and moist. So moist and pink is normal color of stoma. If there is any redness, there is any swelling, so need to be tell to the doctor immediately. So we need to be teach the family and the patient about the how to care for the stoma and also about the diet. So this is all about the Hirschsprung disease, their assessment, causes. So Hirschsprung disease is like congenital abnormality. It's also called the A ganglion or megaclone. It's a hereditary disease, that's the cause. And its assessment is like patient will have abdominal distension and is not able to like infant is not able to pass the meconium, and children also retarded the growth, there will be bowel obstruction. Also diagnosis is through the biopsy we can detect this disease, and complication is the enterocolitis, like it can go to small intestine, it can get the, it can go this disease can this disease can cause the GI bleeding also and infection in the body. Also like medical management, we can go tell the patient like go for the stool softener diet and for the normal saline irrigation that help in the stool bowel movement and for passing the stool. In the surgical management, like we just exercise like take out the part of the large intestine that not having ganglion, like not having nerve cells. The other part we directly join the to the anus. So that's the surgical management. So in the pre-operative, we need to make sure patient is NPO, vitals signs are okay, like patient is breathing, patient have intake output good, and like patient patient don't have dehydration, we need to check if there is abdominal girth, how much the patient weight is. So after surgery we need to make sure patient is bowel sound is there. Until that we need to make sure patient is NPO, and immediately after surgery we need to check the blood pressure, vitals, all the temperature, pulse, respiration, and pain. And also we need to check the surgical side, like if there is any bleeding, infection, we need to immediately tell the doctor, and maintain the intake output, abdominal girth we need to check. And also we need to be teach the family like about how to care for the stoma, if there is any artificial opening created by the doctor, like for passing out the stool. So also teach the patient about the diet, and also the other follow-up we need to tell the patient about that. So this is all about the Hirschsprung disease. This is very important according to the view of the exam. So at the last, please like and subscribe my channel. See you in next video. Thank you.